Hi, welcome to Virtual Dysphagia Training. My name is Katie Cassidy.
And I'm Sophie Elwood.
And we're speech and language therapists with Bromley Healthcare. I'm just going to share the screen so you can see our presentation. Okay, so welcome. As we say, we're going to do virtual dysphagia training today, and it's going to work on identifying and supporting children and young people with eating and drinking difficulties. This is just the basics about eating and drinking difficulties. This is kind of a refresher course, similar to how you'd have fire training each year, just to kind of keep you updated and be useful to use throughout the year for someone who's not feeling so confident, and maybe people that missed the full school training on dysphagia. So as we say, we're speech and language therapists. If you have any questions about anyone who has eating and drinking difficulties in your school, then please speak to your local speech and language therapist or the speech and language therapist that's named on the child's placemat. Today we're going to cover problems that can happen with eating and drinking and strategies that we can use to help these children during meal times and how to support them if they're having difficulties with these. Hopefully by the end of today you'll feel confident supporting a child or young person with their eating and drinking guidelines at meal times. And you'll know it's okay to check things with parents and us where it's needed. So don't ever feel like you're all alone with this. You can always come to us, come to parents. Don't ever feel like you're by yourself, okay? And we should also know when it's time to stop offering that food to a child or young person and making sure we can keep them as safe as possible, and who to tell if you notice any changes in their eating and drinking.
Okay, so we're going to talk through the placemats now. We have two different types, and it's like a traffic light type system. All right, so we've got two different types of placemats. We've got an amber placemat and also a red placemat. Now, for the amber placemats, these are the children that have moderate eating and drinking difficulty, and their eating and drinking will be stable if you follow these guidelines. Now, for these children, they may have been discharged from us because they are stable on these guidelines, and it's the responsibility of the feeder and the parents to check that their eating and drinking looks the same as what is written here. And if they're concerned at all or they feel anything looks different, we would like them to come back and talk to us. And then for the red placemats, these are the children where their eating and drinking is more difficulties are more significant, and that they're more likely to have changing eating and drinking. So things will change over time depending on their alertness and whether they're well. They may be more at risk of silent aspirations. We're going to talk about aspiration a little bit later on, but this is where they might not show signs that they're finding eating and drinking difficult. They will be known to us if they're on a red placemat because they are so changing, and their eating and drinking will impact on their overall health. Okay, so let's take a look about the team around the child supporting their feeding. So firstly, we have physiotherapy, and they will work with us to advise on the best position for feeding. There's occupational therapy, who will advise on suitable seating and equipment for that child, and they can also give advice to support independent feeding. And then the dietitian will make recommendations to make sure that their nutritional needs and their hydration needs are met. And they will provide guidelines that will break down how much food they need to have orally versus how much needs to go through their tube if they are tube fed. And then we have the pediatrician. So they are the doctor that will be overseeing the child's care, and they can make onward referrals onto other specialists, for example, respiratory doctors or gastroenterology doctors. And in some boroughs, they do support with reflux as well. And then there's us, who bring all of this together. So we will look at the child's eating and drinking, and we will assess whether their swallow is safe and what recommendations we can make to adapt it to make it as safe as possible. And this might include consistency, and then working with our other colleagues to talk about positioning and equipment, and also to provide training to feeders.
Okay, and then a very important member of the team is you guys, or the parents, being the feeder. So the feeder will follow the guidelines and advice that has been given by us and the other professionals. and their role will be to feed the child, but also to alert the manager or the speech and language therapist if they notice any signs of difficulties, aspiration, or any changes in their feeding skills. And they have a responsibility to make sure the child has the best possible experience when they're eating and drinking, make sure they're enjoying it and making sure that they're safe. Okay, so now we're going to have a look at the normal swallow. So this is what will happen when everything goes well. So if you have a think about the front of the mouth. In the front of the mouth, the food comes in through the lips and it's broken down by the teeth or the tongue, the gums, into a consistency that makes it easier to swallow. So our children, they might be chewing it, they might be sucking it, anything that makes it an easier consistency for us to swallow. The lips and the cheeks, they work to keep all the food inside of the mouth, and the food gets mixed up with the saliva to make it easier to swallow. Towards the back of the mouth, the tongue pushes the food back, getting it ready to swallow, and the soft palate here closes up to the nasal passage to prevent any food from coming up through the nose. As we swallow, the food comes down into the throat. This flap here covers the windpipe to stop anything from going down the wrong way. And hopefully all of the food goes down into the food pipe and then the airway reopens. All of this happens really, really quickly in the throat. It's less than a second. And then it all goes down nicely into the right tube and goes into your stomach. So things that we change if a child's having difficulty with this might be their positioning, the textures that they're eating, the utensils they're using, their environment, and how the feeder is feeding them. I'm just going to have a watch video now of how it looks for a normal swallow.
So we can see a cross section of the head here, like the diagrams Katie was showing you before. If you see where the cursor is now, there are the teeth, slightly faded but still inside the mouth is the tongue. And then towards the back of the mouth, we can see here the flap that Katie was referring to, the epiglottis. And then we can see the airway at the front and the esophagus at the back. And if we just play, we'll see what should happen. And can you see? Just goes down the back, having a drink now. And if you see the difference between the drink versus the spoon of puree at the beginning, the drink is a lot quicker. It will flow a lot faster than the puree, which takes a bit more time. It looks like they're chewing something. Okay, let's watch again. And they drink nice and quick. In that section there where you see the epiglottis folding down, this all happens really quickly. It's within a second and it's outside of your control at this point.
So have a little break, get yourself a cup of tea and a biscuit and have a think. Think about what your mouth's doing when you're eating, when you're drinking. What's different about when you're having a biscuit compared to when you're drinking your cup of tea? What's going on in your mouth? What's going on with your throat? How does it feel for you? Does it feel nice? Does it feel a bit difficult? If you've got a sore throat, maybe it hurts a little bit to swallow. But if it's a nice warming cup of tea, hopefully it feels quite nice. And think about how easy or how difficult it was for you. Do you think it's that easy for the children that you're helping to feed? How do you think it feels for them? Okay, and now we have to think about it from the other way. We're going to pretend that you are the person that's being fed. So you are the child that you help at meal times, and have a think about how it would feel to have someone else feeding you. If possible, you could try and do an activity with your partner or with someone that you're with in school, but if not, just have a think about how it would feel to be fed by someone else. It'll probably feel a lot different to how it would feel when you feed yourself. So have a think about if your feeder is short-staffed, so they're having to feed you really, really quickly because they've got to go and feed someone else. It probably wouldn't feel great. They're really trying to shove food into your mouth. It's not going to be an enjoyable experience. What about if you have a sore tooth and your feeder has to try and navigate that. So they've got to try and feed you just on one side of your mouth. If you are doing this with a pet, see how difficult it is to try and feed someone just onto one side of their mouth, and how it would feel as the person being fed if you can only chew on one side. And then what about if your feeder is talking away to somebody else? They're probably not paying attention to you and they're talking to someone else. Maybe they're just feeding you without really paying attention. How does that feel as a person that's being fed?
Okay, so here are some of the things that we change if we feel that a young person's having difficulty with their eating and drinking. So firstly, in collaboration with OT and physio, we'd maybe have a think about their positioning. So what we want ideally is for a child to be in a nice upright position, their head in a nice midline position, possibly with a slight chin tuck to protect their airway. And so they're nice and stable, they're not wobbling around, they're not having to think about keeping themselves upright, so they can focus on their meal and for it to be as safe as possible. Another thing that we think about, so what texture is easiest or safest for that child? If they haven't got much movement in their mouths, if they find it difficult to coordinate their tongue movements and their jaw movements, do they need an easier consistency that doesn't need as much breaking down, so something like a puree. We may also adapt the consistency of their drink, so it's a lot easier to drink because the swallow happens so quickly, like we talked about earlier. If a drink is slightly thicker, it gives a child that's got a delayed swallow more time to react to that drink. So we may talk about putting some thickener in a drink, or talk about having something that's naturally thicker. Utensils, so in collaboration with OT, we might have a think about the size of the spoonful that we're giving, so therefore we might use a different size spoon. We may have a different style cup. So for example, if we want to slow down the flow of fluid, we may opt for a straw or a sports bottle rather than an open cup that's got a big hole, which is going to let lots of fluid get to the back of the mouth quickly. And the environment, what does that child prefer? Where do they feel most comfortable? Do they feel more comfortable eating in the dining room with their friends? Because they find eating and drinking actually really distressing, and they need other people around to distract them so that they feel more comfortable? Or do they need a quiet environment so they can focus? Are they likely to have a seizure if they hear a loud noise? They're all things that we should think about together. And then feeder technique, so what does that child need? Do they need a spoonful in between mouthfuls to clear what's there if we can hear something a bit bubbly? Or if they're having difficulty clearing what's in their mouth, do they need an extra spoon to clear what's there? Do they need someone to go a bit slower? Do they need a bit of extra pressure on their tongue? Do they need stronger flavours? They're all things that we would think about. Also skilling up that person to be aware of the signs of aspiration, the signs that a child's finding something difficult. Okay, so let's have a chat about IDSI. So this is the international framework that was introduced a couple of years ago to make sure we're all doing the same across the world. So if you have a child that comes and that emigrates over from America to your school, we will know from their guidelines exactly what they need to be having, because we're all doing the same thing now. So as you can see, there are two different pyramids. So we've got one for drinks and we've got one for foods, and there is a little bit of overlap between the two. So if you think, for example, of a McDonald's milkshake, that's going to be approaching the top end of the drinks pyramid and the bottom end of the foods pyramid. Okay, so just to talk through a little bit more about those textures of food that we were just looking at. So these are moving from easiest to hardest for the child to manage. So we start with a puree, which is nice and smooth, something like a yogurt or a pureed fruit, and this should contain no lumps, should be nice and smooth, and you know, a nice safe consistency for that child to swallow. And then you have a minced and moist type texture. So this would be something like the inside of a jacket potato. So there's a little bit more texture there. It's not quite as smooth as the puree, but it doesn't require too much chewing, but it's still a little bit more mouth movement than you would require for a puree. And then you have the bite and dissolve crisps or foods, so something like a What's-It or a chocolate button, and these start as a solid consistency in the mouth, and as they mix with the saliva and they are moved around in the mouth, they break down. And these are really good for developing a child's chewing skills. And then you have a soft and bite-sized texture, so something like cooked pasta, which is still nice and soft. You don't need to chew it particularly hard, but you do need to use your teeth to break it down. And then you have mixed textures, so this would be a food that contains lots of more than one texture within the same food. So something like a cherry tomato, where you've got the skin on the outside, the pulp in the middle, and then the juice with the seeds in the middle. And you have to do lots of different things with your mouth to be able to control all those textures and swallow them safely. And so for our children that have difficulties with eating and drinking, these are foods that we would like you to avoid. Okay, so just an activity for when you go home tonight or when you're having your lunch. Have a think about what food you're making or what food you're drinking, and see if you can sort it into these categories that we've talked about today. Is it a puree? Is it a soft and bite-sized type dinner? Or there's some mixed textures in there? Have a think. And then thickeners. So for the children that find thin fluids difficult to manage and to drink safely, we may recommend adding thickener to them to make them thicker, to slow down the flow, to give their swallow more time to react. So it's where the IDSI guidelines have come in over the last couple of years. We had thought by now we would have got rid of all the old tins, but actually some of the old tins are still coming in. So it's really important whenever a parent sends in a new thickener tin into school, please double check the child's guidelines and what level they are on. So in the drink section of your placemat, check what level they are on. So are they on an IDSI 2? And then look at the back of the tin and see what the recipe is for that consistency, just to be sure. All right, so this is our when to worry slide. So these are the signs we want you to be looking out for when you're feeding a child. So these are the signs of aspiration. So this is a sign that food or drink is going the wrong way into the airway. So are they coughing? And are they persistently coughing? Is it just one cough? Or are they coughing lots and lots every mouthful you give them? There is a difference. And also thinking across the day as well. Are they coughing lots across the day? And is it worsening when it gets to eating and drinking? Choking. So if the child chokes, this means that something becomes stuck and they're unable to breathe. Then you need to follow the first aid procedure in your school. Eyes watering. Changes to breathing. Is it faster? Is it noisier? Is it slower? Any change from how they were breathing at the beginning of the feed? Has their face changed colour? Do they seem distressed and really uncomfortable? Do they have a gurgly, wet sounding voice after they have swallowed? Do they have noisy breathing? And do they have repeat chest infections, so they're in and out of school quite a lot, and we really want to know if they've been hospitalised as a result of a chest infection. And what do you do if you notice these signs? So we want you to, at that moment, stop offering that particular food to the child or young person and have a think about an easier texture or drink for them to have. So is there something that they can manage better in that particular moment? We want you to tell the child or young person's parent or carer. We want you to highlight it to someone in your senior leadership team or your manager and us if we are involved. And we would like you to reread the guidelines, check what is normal for that child or young person. It might be that maybe the consistency of the food wasn't quite right, and when you check the guidelines and you check the meal, you feel they're not quite right, and that might solve your problem. So it's always good to look there. And only continue to offer that particular food if it is safe to do so.
So with our children that have difficulties with eating and drinking, some of the difficulties can arise outside of meal times as well. An example of this is when we take them swimming. So if you think about it, if a child finds it difficult to drink thin fluids, then being in the swimming pools can be quite difficult and quite dangerous for them. So it's always important to be mindful if a child hasn't eating and drinking that, whether or not they are actually safe to go swimming. This is something you should talk to their parents about to see what they feel and whether they are being taken swimming regularly or not. So if you are taking them swimming, make sure that you keep their head above water. Make sure that they're not getting any of that thin chlorinated water into their mouths, because if they're having difficulties with swallowing thin fluids, then thin chlorinated water is going to be even worse. Try and keep them away from people that are splashing or maybe having a bit of fun over there, to make sure that any water doesn't fly into their face accidentally. And if they do start to show any of those signs of aspiration, then get them out of that situation and seek support immediately. So now it's time for a quiz. Check what you've learned from today. So question number 1. Food's falling out of a child's mouth and you're worried that they're not eating enough. Dining hall is very noisy today. How can you help them to eat? Would you feed her more quickly so that more food will be swallowed? Check the food being offered as the texture described in her feeding guidelines. Talk to other members of staff to see if this is usual. Tilt their head back to help her swallow. Read the guidelines to check whether noise makes eating more difficult for her and consider moving them to a quieter room if possible. Pause the video and have a think about your answers. If you're with other people, maybe talk it through with them and see what you all think.
Okay, and the answer is, so hopefully you came up with these answers. So it's a good idea to check the guidelines always, and check that the food that you're offering is the texture that is described in them. It's also a good idea to talk to other members of staff that are familiar with that child and that have fed them before to see if this is usual. And then again, referring back to those guidelines, have a think. Does noise make eating and drinking more difficult for them? And are you able to move to a quieter room?
Okay, question number 2. Child is refusing their food and they're crying. He's blind and can use 1 to 2 words. How can you help him to eat? Would you tell him if he eats he's going to get a toy? Explain to them what the food is. Offer him a choice of food. Bring the food to his mouth suddenly so he doesn't worry about it. Let him smell the food. Let him feel the food in his hands. Again, pause the video and have a think about what you do.
Okay, what you want to do is you want to give this child as much information about the food as you can as possible. So when they can't see it, you need to make up for it in other ways and use the other senses. So you talk about what that food is, you'd offer him a choice of food, you'd let them smell the food, and you may let them feel it in their hands as well, so they can get as much information about that food and what's going into their mouth as possible.
Question number 3. Which of these would make you worry about a child or young person's eating or drinking? The eyes watering, child or young person smiling, them coughing, child or young person getting excited, using a clear, loud voice, child or young person looking around the room, face going blue, their face going red, breathing becoming difficult or more noisy, or them screaming. Pause the video and have a think.
Okay, so these are the signs that we'd be worried about. So eyes watering, coughing, face changing colour, and breathing becoming difficult or more noisy.
Question number 4. And so if you saw any of those signs that we just spoke about, what would you do? Ignore what you've seen, check the feeding guidelines, tell the teacher, give them a drink instead, talk to the speech and language therapist if the child or young person is known, try feeding the child or young person in a different position, tell the deputy or head teacher, hope the child gets better, stop feeding the child that food. Pause the video and talk about it yourself and think about your answers.
Okay, so here are the answers. We would check the feeding guidelines and see what is normal for that child. We would tell the teacher. and the parent. You would talk to us if we're known to that child. You would tell your line manager, so that may be your deputy or head teacher, and you would start feeding the child that particular food, and you would think about other foods that the child might be able to have instead.
Question number 5. Child is coughing on every spoon of yogurt you give them. They sound like they're gargling and their eyes are watery. Mum told you that she's very worried their child isn't eating enough. What do you do? Tell mum that you'll try and feed them more at lunchtime. Stop giving the child yogurt. Tell your manager immediately. Tell your manager when you next see them. Give the child water to stop them coughing. Help the child lie down and have a rest. Pause the video and have a think about your answers.
Okay, so you would stop giving the child the yogurt. You wouldn't stop feeding them completely. You would have a think about other foods that they may be able to have instead. So is that yogurt particularly watery? Do you need to offer a thicker yogurt? Do you need to offer something like a custard? Is that easier for them to handle instead? And you should tell your manager immediately. And also the parent, you should tell them.
Number 6. You've been assigned a new child to feed at lunchtime. They have a red placemat. You haven't had any extra training from a speech therapist. What do you do? Read the placemat or guidelines and follow them strictly. Tell your manager you need extra support to feed this child. Stop supporting the young person and find someone who's trained to support them at mealtime. Invite mum in to feed the child. Contact the speech and language therapist to request training. Pause the video and have a think about your answers.
Okay, so that was a bit of a trick question. Actually, all those answers you have there are correct. And we'd like you to think about all of these options. So you would always, in any situation, you would read the placemat or the guidelines very carefully and follow them as strictly as possible. But with a red placemat, that's even more important because this child is, we know that their eating and drinking can be, it's a significant problem for them. So we do need to be following those guidelines as strictly as possible. You should talk to your manager about getting some extra support to feed that child. So that may be asking someone who's fed that child before to come and show you how to feed them or talk you through it and be with you while you're feeding that child. The bottom line is that child does need to be fed. So we don't want a situation where a child hasn't had anything to eat or drink that day because they can't find a speech and language therapist. Try to work around the situation so that child can have a meal as safely as possible. Another option may be to invite mum in to feed the child if this is possible in the current situation. And also we would like you to contact us to request training, but as there may be a bit of a delay in this, you might not get us there for that lunchtime. It's a good idea to try these other options first. Okay, thank you for listening. We hope you learned lots today. If you have any questions, please do contact us or speak to your speech and language therapist in school. And hopefully you feel like you've learned something today.